salicylic acid, glycolic acid, sheet mask, haldi, neem, tulsi, all that jazz. You've tried everything, but फिर भी the pimples are not going away. So like every human has a story to tell. Your pimples also have a story to tell. All you have to do is listen. Hi, I'm Dr. Shikha Shah. I'm a Mumbai-based dermatologist, also known as Dr. Shikha Says. In this video, we're going to understand what exactly is acne, what are the types of acne, and where all do we get acne, and what is the reason of getting them, and how can you avoid them, instead of randomly applying so many things on our face. So acne is a medical term for what we commonly known as pimples. What are the types of acne? Blackheads is a type of acne. Whiteheads is a type of acne. The pus-filled boils, the nodulocystic ones, the painful deeper ones are all forms of acne. So if you're continuously getting pimples on your forehead, what are your pimples trying to tell you? That shayad you're doing some oiling in your scalp, or even worse, you're sleeping with oil in your head. So what can happen? The oil can basically trickle down on your forehead, clog the pores and result in acne. The second thing could be you're wearing hairbands, headgears, helmets, and you're not cleaning them. So when we wear all of these things, there's a lot of sweat, there's a lot of bacteria, there's a lot of clogging of the pores, a lot of oiliness, and जब फिर से हम यही वाले uncleaned things use करते हैं, तो again it can result in oiliness and that can trickle down and cause forehead acne. So what to do? When you're doing your oiling, just apply it on the hair 1 hour before shampooing. Don't keep it overnight, and don't apply oil inside your scalp. The other materials that you use, hairbands, helmets, can be cleaned properly very regularly. Your hairbands can be dipped in warm water and उसमें थोड़ा antibacterial soap add कर दो, and then you can soak it for about 10-15 minutes and then clean it properly. Now the second area where you could be getting acne continuously is your cheek area. Some people have a habit of using their phone on one side of the cheek. So you can try to observe if you get acne on one side of your cheek and you're actually holding your phone on this side, your pimples are trying to say don't do that please. And also we keep our phones sub jaga all throughout the day. So I like to clean my phone ka surface at least 2 times in a day, so that all the bacteria, dirt, pollution, everything is out of the phone and I don't pass it on to my cheek. The second reason why you're getting acne on your cheeks could be because you're not changing your pillow covers and bed sheet covers for a longer duration of time. तो उसके ऊपर भी dust, bacteria सब जमा हो जाता है and then that comes onto your cheeks. The third reason could be rosacea. So rosacea is another inflammatory disease that looks like acne but is not acne exactly. And there's a lot of redness also of the cheeks, and there are certain triggers of rosacea. You can check for them. Like hot water, hot tea, any hot drinks basically, lot of sun exposure, stressing out, smoking, alcohol, spicy food, chocolate, cheese, all of these kind of aggravate the redness and the acne. Always get that ruled out by a dermatologist. The third place where you could get acne is your chin area and your jawline area. Usually this is an indication of some hormonal imbalance happening inside your body. The second reason could be that you're stressing way too much. And the third reason could be you're using certain lip cosmetics and like lip balms or lipsticks. So try to observe if you started some new lipstick and then you start getting acne around your this entire oral area, or you started some lip balm or something which has perfume in it. So be a little careful about that. And when it comes to hormonal imbalance, you can have certain other symptoms also, like losing a lot of hair, or excessive hair on your face, on your body, or you could have menstrual irregularities. If you have any of these symptoms, it's always better to get it checked by a dermatologist or a gynecologist so that they can order a sonography and a blood checkup and rule out certain hormonal imbalances happening in your body, like PCOD or some other endocrinal problem. So when the inside is not fixed, it's never going to fix the outside. Always remember that. The fourth area where you may be getting pimples are your back and your upper arms. So if you're somebody who works out and wears these synthetic nylon clothings which are really tight, these tight gym wears, then two things are happening. One, there's a lot of friction between the skin and those clothings because they're really tight. The second thing, there's a lot of sweating when you're exercising. So all the sweat, dirt, everything gets clogged inside over here, and that results in acne. The second reason why you could be getting acne on your upper arms or your back is because you don't take a shower after you work out. So all that sweat is not clent off, and that results in acne. So what to do? You can wear loose cotton clothing. And second, if you already have the acne over here in these areas, then you can use a 2.5% benzoyl peroxide soap. You can lather it with water, apply it for 5 minutes and then wash it off. Always do a test patch before you start. The other area where you can get pimples is your scalp. So you may be getting these boils on the scalp continuously. So that can be because you have an oily scalp or you're excessively oiling your hair. So stop doing all of these things, and that may result, and also start cleaning your scalp more regularly. That is, shampooing it more regularly if it gets oily. The last area which I'm going to talk about where you get acne is this area, and that's called as maskne. It's really common right now. It happens because of wearing the mask. You have to wear your mask. There is no getting away with that. But there are certain tips that you can follow so that you can prevent the acne from happening. Before wearing your mask and after removing your mask, you're supposed to use a very mild cleanser. Cleanse your face, wash your face with that. Don't use anything harsh. And after cleansing your face, apply a water-based moisturizer. So when you apply a moisturizer, it's kind of forming a layer between the mask and the skin. So that kind of protects your skin. The other thing you can do is apply some petroleum jelly on your lips, because the lips are also getting chapped because of continuously wearing the mask. If you're a healthcare worker or somebody who requires to wear mask for a longer period of time and you're trying to include some new skincare regime in your schedule, then my advice would be to avoid retinols, AHA, BHAs, all these things in your schedule for a while, because your skin's already a little sensitive. What are the general tips for preventing acne? So one, have a really good skincare routine. Be very consistent with it. It can be something very simple, like in the morning you can cleanse your face, apply a water-based moisturizer, wait for about 15-20 minutes and then apply your sunscreen. At night, remove your makeup if you're applying any, cleanse your face, apply your anti-acne cream if given by the doctor, and then you wait for some time and apply your moisturizer. The second thing that you can do is, whenever you use any skincare product, hair care product or any hair styling product, make sure that they are not very creamy, not very oily. Use non-comedogenic ones so that they don't clog your pores and result in acne. The third thing, exercising daily is very important, because that stabilizes your hormones from inside, and that's how your skin starts showing up then. The fourth thing you can do is your diet. Dairy, sugar and processed food, all of this are going to trigger your acne. So if you're somebody who does get acne or have acne prone skin, you can try avoiding all these and seeing if it's making a difference in your life. The fifth thing and the most important thing is that we need to stop stressing. So meditation, breathing exercises, anything like art or music, anything that helps you daily for some time. You need to remove some time for yourself and reduce the amount of stress you're having in your body, because that will not only show up on your skin and hair, but also it'll help your mental health.
Subscribe to our YouTube channel and hit the bell icon so that you don't miss any videos by us.